The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and we're glad you've joined us today. And today we're going to be talking about another disease that plagues many in especially Western countries, but now going around the world as well as people adopt the Western lifestyle, and that's diabetes. And here to talk with us about diabetes is Dr. Timothy Lawton. He's a physician in Wichita, Kansas, and he specializes in lifestyle medicine. He's a member of the American College of Lifestyle Medicine, and he also has practiced for about 10 years. Welcome to the program.
Thank you, Don.
And we're going to be talking today about diabetes. Let's just get right into it. That's a huge problem. You're telling me some fascinating statistics about the magnitude of the problem.
It's growing and growing exponentially here in the United States. That's why they call it an epidemic. The definition of an epidemic is something that is occurring more frequently, more often than you would expect. So the numbers in the U.S., it's currently the number 5 cause of death. It's expected to be the number 1 cause of death by 2010.
So it's just continuing to get worse and worse and worse. Why are so many people getting diabetes?
There's a very, very strong connection with obesity, also inactivity. Those are the 2 biggest factors that we relate to diabetes.
So Americans and those in Western nations are getting bigger, and diabetes is one of the things that comes with that.
And you know what, Don, this is really a global epidemic. It's not just confined to the U.S. It's estimated that the majority of diabetes cases in the world over the next 10 or 20 years are actually going to be in China and India.
And is this because they're following the example of the Western nations in what they're eating?
As we export our food and our labor-saving devices and transportation, more people are getting automobiles and so on.
What about children?
Big. You know, this is something that kind of leads into the next concept. There's traditionally been 2 kinds of diabetes that we've recognized over the years, type 1 and type 2. We used to call them juvenile onset, which was type 1 diabetes, and adult onset, which is type 2, which has more to do with the lack of physical activity and increasing obesity. But now that children are getting less and less physical activity, we are seeing the adult onset type of diabetes occurring in children, the type 2.
Now, in your practice, in your lifestyle medicine center, vitae means life, I guess, in Latin.
Right.
Do you have any young people or children that come in to the clinic?
We have some that are on the verge of developing diabetes.
Mm-hmm. And this is a huge problem, I know, across Kansas and, of course, around the world. I mean, I've listened to folks just talking about this. Well, let's look a little closer at what the definition would be. What would be the definition you'd give us for someone who's a diabetic? How can you tell?
Well, we use the medical definition, and there's a medical definition that's defined as normal blood sugar, first of all. Normal fasting blood sugar, when you've had nothing to eat for at least 8 hours, is 70 to 99, and that's a very narrow range. The body tries to keep there. There's a gray zone, the in-between zone called prediabetes, which is 100 to 125 fasting. And then the actual medical definition of diabetes comes when you get to over 125 on 2 separate occasions.
And those numbers are amount of sugar per blood or something, 70 to 99?
Yeah, it's a milligram percent measurement, but that's what's measured either with a blood sample from the vein or a finger stick.
Now, do
blood
they
sugar.
have different ways of measuring this around the world? You know, I think they have different numbers or something, but that's the American system, 70 to 99 and all that.
Well, this is the global
The global
system, yeah.
So, and you can get that tested by your physician. They do a blood draw, and they can do all those tests if you have any question. Any other ways to tell whether or not you have diabetes? Let's say you're in a country and you didn't have that, that opportunity to have a blood test.
Well, we often look at the signs and symptoms of diabetes. Classically, people who have increased urination and increased thirst, unexplained fatigue, sores or wounds that don't heal, these can be signs related to diabetes. So if someone has one of those symptoms, they should be seen by a doctor to get their blood sugar checked.
Is this something that people just have to roll over and say, I'm going to get diabetes because it's increasing?
Well, this is something that is the tragedy, but also the good news is that diabetes is almost entirely preventable. And I mean the type 2 diabetes that's related to lifestyle. 95% of the cases of diabetes in the world and the U.S. are the adult onset or the type 2 lifestyle diabetes.
Okay.
The type 1 is a different kind of diabetes, and the main difference in type 1 diabetes is the body doesn't make any insulin. So you need to have insulin shots with type 1 diabetes. Type 2 diabetes, the body makes insulin, and often it makes more insulin than a normal person. It's just that the cells in the body are resistant to insulin. That means the insulin that's there isn't getting that blood sugar to go into the cells.
And I think you have a graphic that's looking at preventability, or the fact that the majority of this is preventable.
91%, according to one very large study. This was a study called the Nurses' Health Study. They followed 85,000 nurses for 16 years, and they concluded that 91% of the new cases of type 2 diabetes were related to lifestyle factors.
Wow, so
that's incredible. Imagine if we could eliminate 90% of the cases of diabetes in the country.
Well, this is dependent on decisions and choices and going against the tastes and habits that people have developed.
You know, since diabetes is such a big epidemic right now, there's been a lot of interest in new drugs for diabetes.
Well, which is better, drugs or lifestyle?
Well, there was a study that addressed that. They looked at 3,000 individuals and followed them for 3 years. And the conclusion of the study showed that diabetes was more effectively prevented with lifestyle interventions than with the drug intervention.
Again, I think you have a graphic on this, don't you?
Yeah. The lifestyle intervention that they used on was not terribly difficult. Here's the graphic. It says 31% fewer cases of new onset diabetes with the medication, 58% fewer with the lifestyle intervention.
That's significantly different, yeah.
And the lifestyle intervention was to lose 7% of excess body weight if they were overweight, and to exercise moderately for 150 minutes a week. 150 minutes a week is less than 30 minutes a day. It really is very doable.
Very doable. Let me ask you a question. Drugs versus lifestyle. What kind of drugs do they take? And I want to talk about the lifestyle. I mean, that's what you specialize in.
Well, let's talk about the alternative. Every patient has a choice. You can take the drugs, for sure. But if you look at simply the cost of drugs, and of course some of the side effects, your typical diabetic may be on $400 or $500 worth of drugs a month. 1 or 2 or 3 drugs to control their blood sugar, 1 or 2 drugs for their cholesterol, 1, 2, or 3 drugs for their blood pressure. Can you imagine how quickly that adds up, plus the risk of the side effects? You got to do the lifestyle, even if you're on drugs.
And then, of course, many people watching may be in parts of the world that they simply don't have the drugs available. They don't have that option. So lifestyle, again, is going to be the answer for them. Let's look at some of those things in lifestyle that we can do to prevent and maybe perhaps, would it be fair to say, stop or reverse diabetes?
That's good. Before we do that, there's a graphic on, I have a picture of a cell.
Okay, let's look at that.
Understanding what is going on with this concept of insulin resistance.
Okay.
This blue circle represents a cell, and the G's represent glucose, and the I represents insulin. Now, this cell here, because we've been overfeeding the body, because we've been putting in foods that are too sugary in general, and sometimes too fatty, the cell has got a full charge. It's got all the glucose, all the sugar and energy it needs. And that little brown rectangle there, that's the door on that cell. That's the door that insulin is supposed to be able to open. But when the cell is full, it's kind of like your elevator. If your elevator is full, no matter if the door is open, you can't get anyone else in. So you got to open up the door and get rid of some of that sugar that's filling it up.
So the problem is, you know, the pancreas, I guess, is secreting more and more insulin, but it just can't get in.
You know, the room's full.
So how is it that we open the door again?
Well, you can do it very quickly through a therapeutic fast, which if you're on insulin or medications, you need to do that under medical supervision and check your blood sugar. You can do it more slowly with increasing your physical activity and making some fairly significant dietary changes.
Okay.
Actually, more slowly, you can probably do it in a matter of days to weeks with some pretty dramatic nutritional changes as well.
And this is the kind of thing you do with diabetics at Vitae Health.
Right, right. Some people we will have on a medically supervised fast, usually for 3 days. It doesn't need to be a horribly long period of time. The other thing that we focus on is the physical activity and weight loss. Mm-hmm. This one study showed 7% weight loss, 15% weight loss can make a huge difference. You don't need to lose 100 pounds to improve your blood sugar control. So 20 pounds can make a big difference.
So weight loss through what mechanisms? Exercise?
Burning off more calories than you take in.
Not through amputation, right?
Funny you should say that. Liposuction, you could take 20, 30 pounds off with liposuction, but it's not the insulating fat that is important for diabetes. It's what's inside, under your abdominal wall. It's the fat that surrounds your organs, that surrounds your liver, your intestines, your kidneys. It's the internal fat that makes a difference. They actually have done studies where they've had people with diabetes and they have them get liposuction. They weigh 30 pounds less, but
they still have diabetes.
It hasn't changed a thing metabolically.
Oh, that's fascinating. So it's the insular fat around the organs and internally.
It's called, it's visceral, meaning around the organs. That's and the reason why losing 15% of your weight or 15 or 20 pounds makes a difference is it's that visceral fat that's starting to come off. You might not look a lot different with your layer of insulation, but you've reduced your visceral fat and you've improved your metabolic control of diabetes and cholesterol and other things.
Fascinating. We're talking with Dr. Timothy Lawton. We're talking about diabetes. It's a huge problem in America. It's going to be the #1 cause of death and disease in just a number of years unless something's done. We hope that's not the case in your life. If you have a family history of diabetes, if you know someone in your family that has diabetes or a friend, this is the program for you. When we come back, we're going to be looking more specifically at what can be done to stop, prevent, perhaps even reverse diabetes if you have it. So join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call her right today.
Welcome back. We're talking with Dr. Timothy Lawton. He's a physician in Wichita, Kansas. He focuses on lifestyle medicine, and what he has discovered, and many are discovering, is that medication and traditional medicine alone, while very helpful, many times is not addressing really the building blocks of disease. And we're talking about diabetes today, and Dr. Lawton has brought to our attention that there are really things you can do, put you in the driver's seat so you can stop, prevent, the best is to prevent or avoid diabetes, which is a huge concern. You actually run a lifestyle center, Vitae Health there, Vitae Medical Center it's called, right?
We call it Lifestyle Medical Center because our foundation, our emphasis is really on the lifestyle factors. We will use medication if need be, but our goal is really to get people more in control of their health through lifestyle factors that they can control themselves and reduce their burden of medication.
So Vitae, which means life, and
right.
then Lifestyle Medical Center. Okay, that's great. So in other words, you have the best of two worlds, hopefully.
That's the goal, yes.
All right. And when you're dealing with the diabetic, you know, it's a huge problem. And let's just summarize what you've said. First of all, you don't necessarily have to develop type 2 diabetes. Sometimes type 1, people just develop that for whatever reason. But what have we said so far? Our approach is to, you know, preventing or perhaps even reversing if someone has it.
Right. Just to summarize, there was a large study that showed that the majority, over 90% of new cases of type 2 diabetes were related to lifestyle and diet. Imagine if we had 90% fewer cases of diabetes. The epidemic would be gone.
Mm-hmm.
And it really tells us where we need to focus our energy because it's so expensive to treat diabetes. It's so much more logical to just prevent. And the other thing we talked about is losing weight. Even 15 or 20 pounds can make a significant difference in improving blood sugar control or reducing one's risk.
Mm-hmm. Okay, let's continue on then. You're going to talk to us about foods.
There's a measurement called the glycemic index, and this is a newly emerging approach to helping patients manage their blood sugar. When you look at the concept of the glycemic index, it refers to how quickly a food will raise your blood sugar. And what we really want to do is keep the blood sugar stable as long as possible. Let's just give the example of breakfast. Don,
okay.
I could eat a high glycemic breakfast, and high glycemic foods are typically going to be the refined and processed foods as opposed to the foods that grow in nature. But for breakfast, let's say I'm going to be good. I'm going to have a bowl of Cheerios. Now, I've read that that's a low-sugar food, but that oat flour has been highly processed. It's very small particles. It's going to do about the same for me as a bowl of Fruit Loops, a can of Coke, those sorts of high glycemic foods. My blood sugar will go way up for a short period of time, then it'll come crashing down. I'll be hungry again by 9:30 or 10 in the morning because there's nothing to sustain me.
So instead of having the Cheerios, you would have what?
Say I make myself a bowl of hot porridge, maybe some oatmeal, maybe a 9-grain mix. That is in its whole form. It's going to give me energy over several hours, 3-4 hours or so before I start to lose the effect of that meal.
Same thing with juice versus fruit?
Exactly. The whole fruit, in fact, the orange is one of the most sustaining fruits that we have. Apples and oranges, surprisingly, although we think of them as being sugary, they actually have quite a bit of staying power. When we eat the orange as opposed to the orange juice, or the apple as opposed to the apple juice, we get a longer, more stable blood sugar.
This is especially important even if you are a diabetic. You want to keep those stable if at all possible, I'm sure.
Even if you're not. I just think about trying to keep maximum energy, maximum focus and clarity of mind throughout the day by eating low glycemic foods.
Let me go through a couple of foods. What about white potatoes?
Now, white potatoes are about the only exception. They are moderate to high glycemic levels, which means white rice white bread. These white foods are going to tend to have a higher glycemic index and tend to shoot your blood sugar way up and then you come crashing down shortly later.
Corn?
Corn is kind of moderate. It's really not too much of a concern.
Carrots?
Carrots, although some people have thought they are one of the sugary, starchy vegetables, they really are a low glycemic food.
What about raisins versus grapes?
You take a cup of grapes and you take out all the sugar, or I'm sorry, you take out all the water and you're left with just the sugar condensed. So grapes have a low glycemic index. Raisins have a very high glycemic index.
So better to have like some kind of full grain cereal with grapes rather than
or berries.
Raisin Bran.
Berries are one of the lowest.
Berries.
So I will often, if I make a bowl, I'll put on some blueberries or something like that. Mm-hmm. The raisins, though, let's talk about the glycemic load is the concept of when you take all the food at that meal. Let's say you want to have that stir fry, mm-hmm. and you're concerned about your blood sugar. Well, you want to have a smaller amount of rice, a larger amount of vegetables. Or if you have rice, you want to choose the brown rice as opposed to the white rice. But still, keep the portion moderate, focus more on the vegetables. Mm-hmm. If you want to have raisins, but have some mixed nuts. Nuts and beans are extremely low as far as the glycemic index.
So glycemic index, I'm sure if someone went on the internet and put in glycemic index, they'd find a place where they get all kinds of lists.
And there's books on this too, absolutely.
And at the Vitae Lifestyle Medicine Center, you help people with all that kind of stuff and help them know what those are. I suppose probably just moving to, some of these things are, orange juice is going to be an improvement for lots of people that have the problem, and some of these high glycemic things are a definite improvement for most people. But this is kind of a nuance on top of making a switch toward plant-based things.
Right. The other big factor, which hasn't been fully utilized, is the concept of fiber. When we eat foods that are high in fiber, it tends to slow down the digestion. It slows. There's something called soluble fiber. Soluble fiber makes like a gel inside our stomach so that food energy is released much more slowly, we're satisfied longer, and the sugar is more stable.
And I think you have a graphic to describe this.
Yeah, there's certain foods that are very rich in fiber as they're related to diabetes. Interestingly, it's the grains, the whole grains, that are the most stabilizing when it comes to stabilizing blood sugar. Beans are up there just about the same, and then vegetables.
Okay. So grains, beans, and vegetables. I mean, some particular cultures, you've got rice and beans. I mean, that's the staple. And that's a very good thing.
That is. And as those cultures have converted more to a Western diet, that's where we're seeing more of the epidemic of diabetes occur.
Okay, so we've talked about weight loss, we've talked about glycemic index, we've talked about eating more fiber. What else?
Well, one interesting thing is the use of vitamins with diabetes. The word diabetes, mellitus, means sweet urine. And so when we think about what happens, diabetics urinate more and they lose more of the water-soluble vitamins and minerals. In fact, it's almost all the water, almost all the vitamins. The B vitamins, vitamin C, magnesium, and zinc are things that are especially low in diabetics. These things are extremely important for the heart. Mm-hmm. They're extremely important for skin to heal. They're important for preventing infections. And we have a slide on one study that was done using a vitamin supplement. They took 130 patients with diabetes, and they were given either a multiple vitamin or a placebo for 1 year. And the results were astounding. 93% of the diabetics who took the placebo reported having at least one infection during the year, versus only 17% of those taking the multiple vitamin reported having an infection during that year. So there's a lot less missed work for those who were employed.
So these multivitamins are a benefit. Now, if you can get everything that's in your multivitamin from what you're eating, is that even better, or?
No question, no question. When we look at something like the prevention of cancer, there's so many nutrients, we call them phytochemicals or phytonutrients, that help to prevent cancer. that you don't get in your one-a-day multivitamin.
What about physical activity?
That probably should be the number one thing diabetics think about, or people who want to prevent diabetes think about. It's that physical activity that helps to take that stored up sugar that's in the cells and burn it up and use it.
What's the best time to have the physical activity?
That's a good question. I think the best time is the time that you can work it in to your day. It doesn't have to be all at once. Recommendations, include 30 to 60 minutes of moderate activity on most, if not all, days. And if you can do, if you do it all at once, that's fine. If you break it up, that's fine also.
What about rest, stress management?
Stress increases your blood sugar. People who are chronically stressed or don't get enough sleep, they will tend to have more trouble managing their blood sugar. So it's important to take good care of yourself.
Okay. Anything else?
One other thing I will mention with the diabetes is there are certain kinds of fats that are beneficial. There's something called trans fat or hydrogenated fat, actually increases the risk of developing diabetes. And there's a good kind of fat, which is called omega-3, which actually helps to reduce the risk of diabetes and helps diabetics improve the control of their blood sugar.
It says there's something about hemoglobin A1C. What's that all about?
Yeah, the hemoglobin A1C is the measurement of average blood sugar over the last 3 months. A finger stick will tell you what's happening right now. The A1C tells me what the average has been over 3 months.
Okay, so summarize this all for us. We've got about a minute left, and what do you want to say in that last minute to someone who has diabetes or wants to avoid it?
The most important thing has to do with factors that we can control. Has to do with the amount of exercise we get, the amount of sleep and relaxation, the stress management component, and most importantly, the foods that we eat and the quantity of the foods that we eat.
We're talking with Dr. Timothy Lawton, and he has given us some great advice on how to handle this problem of diabetes. It's a huge problem in America, and I know if you're watching today, you probably know someone that has diabetes, and no one wants to have diabetes. It causes huge problems, and if we can avoid those problems, man, I tell you, that's what we want to do. Thank you so much for joining us today, Dr. Lawton, and taking time out of your busy schedule.
Thank you, Don. It's been a pleasure to be here and share this important information.
And thank you for joining us today. We hope that the approach that you heard today is something you can implement and share with your friends and your family. Thanks for joining us on Health for a Lifetime.